As we age, our bodies change in ways we don't always notice. Bones gradually lose strength, colds seem to visit us more often, and sometimes we feel tired even after a full night's sleep. Take Mrs. Johnson, a 72-year-old grandmother. She always thought her weakness and back pain were just part of getting older. But after a simple blood test, she discovered her vitamin D levels were very low. After a few months of treatment, she regained her energy, started walking daily again, and even went back to her garden, something she had stopped doing for years. One essential nutrient plays a powerful role in protecting us: vitamin D, often called the sunshine vitamin. In this video, we'll explore why vitamin D is so important for seniors, how it strengthens bones, boosts immunity, supports mood, and most importantly, how you can get enough of it safely in everyday life. What is vitamin D? Vitamin D is not just another supplement on a pharmacy shelf. It behaves more like a hormone in the body, guiding calcium absorption, activating immune cells, and influencing serotonin, the feel-good chemical in the brain. Think of vitamin D as the conductor of an orchestra. Without it, the instruments, calcium, immunity, and mood, all play out of tune. With it, everything works together in harmony. Studies show that more than half of U.S. adults are deficient in vitamin D. For seniors over 60, the number is even higher, often above 70%. Dr. James Miller, a geriatric specialist, recalls a patient in his late 60s who constantly felt exhausted and complained of poor sleep. Lab results revealed a severe deficiency. After consistent supplementation, his energy improved, his mood lifted, and his blood pressure stabilized. This case shows vitamin D deficiency isn't just a number on a lab test, it has a visible impact on daily life. Bones and osteoporosis. Calcium is the brick that builds your bones, but vitamin D is the key that lets the body use those bricks. Without vitamin D, even if you drink milk or take calcium supplements, much of that calcium passes through unused. Maria, a 68-year-old retired teacher, learned this lesson the hard way. Despite drinking milk every day, she developed osteoporosis and suffered a painful wrist fracture after a small fall. Her doctor explained that her vitamin D was too low, making the calcium ineffective. Maria began a routine of vitamin D supplements and light sun therapy. Over the months, bone density improved and her risk of future fractures dropped. Osteoporosis affects millions of older women. Fragile bones that break from a simple stumble are often the result of long-term vitamin D deficiency. Maintaining healthy levels can reduce fracture risks, protect independence, and allow seniors to keep enjoying activities they love, from gardening to playing with grandchildren. The cost of fractures. Hip fractures are among the most serious dangers for seniors. Mr. Thompson, 74, fell while gardening and broke his hip. His recovery lasted nearly a year, and he now relies on a cane for mobility. Many seniors never regain full independence after such injuries. By contrast, in a large clinical trial, seniors who took vitamin D along with calcium experienced up to 30% fewer fractures than those who did not. This difference is life-changing. It can mean the ability to walk confidently at home versus months of rehabilitation or long stays in nursing facilities. Every fracture avoided is more than a number. It is a life preserved, an elder staying active in the community, and a family spared the emotional and financial cost of long-term care. Something as simple as maintaining vitamin D can dramatically lower the chance of these devastating accidents. Immunity and illness. Vitamin D acts like a switch that turns on immune cells, helping the body defend itself against colds, flu, and infections. During the COVID-19 pandemic, researchers found that patients with healthy vitamin D levels often had stronger immune responses and less severe illness. Mrs. Helen Brown, a 70-year-old retiree, tested positive but recovered quickly without hospitalization. Her doctor noted she had been on vitamin D supplements for years, which may have contributed to her resilience. For seniors, maintaining immunity isn't just about avoiding a cold. It can mean the difference between mild symptoms and life-threatening illness. A strong immune system reduces hospital visits, shortens recovery times, and allows seniors to enjoy everyday life with confidence. Chronic diseases. Vitamin D doesn't just protect against seasonal infections. Research links low levels to higher risks of diabetes, heart disease, and even certain cancers. At Harvard, a long-term study showed seniors with higher vitamin D levels were significantly less likely to develop type 2 diabetes. Another study found that heart patients with healthy vitamin D levels lived longer and had fewer complications. Take Mr. Rivera, 66, who struggled with high blood pressure and early diabetes. His doctor added vitamin D supplements along with exercise and diet changes. Within months, his blood sugar stabilized, and he felt strong enough to resume his daily walks. Vitamin D alone isn't a miracle cure, but it plays a supportive role in protecting against serious age-related diseases. Combined with good habits, it can extend not just years of life, but quality of life. Mood and brain health. Many seniors notice feeling winter blues or unexplained fatigue. Low vitamin D is often part of the cause. Vitamin D helps the brain produce serotonin, which stabilizes mood and energy. Low levels are linked to depression, fatigue, and lack of motivation. In one European study, seniors with deficiency were nearly twice as likely to experience depression compared to those with healthy levels. Anne, 75, dreaded the winter months. She felt down, isolated, and tired. After a blood test, her doctor found her vitamin D was extremely low. With supplements and short daily walks outdoors, her mood improved dramatically. She regained her motivation and began attending community activities again. Adequate vitamin D doesn't just protect the body, it nourishes the mind. A brighter mood means more energy to stay social, connected, and engaged in life. Sunlight. The body naturally makes vitamin D when sunlight hits the skin. For younger adults, 10 to 15 minutes outdoors may be enough, but seniors produce less with age. Add long winters, sunscreen, or limited outdoor activity, and deficiency becomes likely. Mr. Robert Miller, 70, loved walking outside, but living in a northern city meant his vitamin D levels dropped sharply each winter. His doctor explained aging skin absorbs less sunlight. Now, he balances daily walks with a safe supplement plan. Sunlight is the most natural source of vitamin D, but for many seniors, it works best when combined with food and supplements to maintain healthy levels year-round. Food sources. Food can make a meaningful difference. Salmon, tuna, and mackerel are excellent natural sources. Egg yolks and fortified milk also help. A senior center in Florida added salmon once a week to their meal program. After 6 months, residents showed higher vitamin D levels and reported fewer aches and pains. Adding even one serving of fatty fish per week can improve vitamin D levels significantly. For seniors who enjoy cooking, small dietary changes, like an omelet with eggs, fortified cereal, or grilled fish, can yield big rewards for bone and immune health. Supplements. For many seniors, sunlight and diet are not enough, and supplements are necessary. Doctors often recommend 800–2000 IU daily, though the right dose depends on individual health. Mr. Patel, 70, suffered constant fatigue and knee pain. After testing, his doctor prescribed 1000 IU vitamin D daily. Within 2 months, he regained his energy, walked longer distances, and even slept better. Supplements are affordable and widely available, but they must be taken with proper medical guidance. Regular blood tests can ensure the dosage is both safe and effective. Precautions. Because vitamin D is fat-soluble, too much can accumulate in the body. One patient, a 65-year-old man, assumed more is better, and took 10,000 IU daily without supervision. He developed kidney stones, nausea, and serious health issues. Balance is key. Enough to protect health, but not so much that it causes harm. Seniors should always consult doctors, especially if they take other medications or have kidney conditions. Conclusion. Vitamin D is truly the sunshine vitamin, supporting strong bones, a stronger immune system, and a brighter mood. Just 10 minutes of sunlight a day, along with foods like salmon or fortified milk, can strengthen the body. And for many seniors, safe supplements provide the final boost. Like Mrs. Johnson, the grandmother who regained her energy, you too can feel stronger, more active, and more confident. By paying attention to this one simple nutrient, you can protect your health and enjoy your golden years to the fullest. For more senior health tips, don't forget to subscribe, like, and turn on notifications.